Coronavirus disease 2019, COVID-19, is a contagious disease caused by the coronavirus Sars, COV-2, 1. Introduction, Overview of coronaviruses, brief description of coronaviruses, past outbreaks, SARS, MERS. Origin of COVID-19, how COVID-19 was first identified, likely origins, initial outbreaks in Wuhan, China. 2. Early stages, December 2019 to January 2020, first cases in Wuhan, China reports the outbreak to WHO, initial response, spread to other countries, international travel contributes to the spread, first cases outside China in Thailand, Japan, and South Korea, initial WHO response, WHO declares a public health emergency of international concern on January 30, 2020, 3. Global spread and lockdowns, February, March 2020, virus spreads globally, Italy, Iran, and South Korea experience severe outbreaks, lockdowns and travel restrictions, nations begin imposing lockdowns and travel restrictions, WHO declares a pandemic on March 11, 2020, impact on healthcare systems, strain on healthcare systems worldwide, with hospitals overwhelmed, especially in hotspots like Italy and New York City, for scientific response and research. Vaccine development, early efforts by various companies and governments to develop vaccines, discussion of mRNA technology, treatments and clinical trials, use of existing drugs. Like hydroxychloroquine, remdesivir, the role of clinical trials, public health measures, social distancing, mask mandates, testing, and contact tracing efforts. 5. Social and economic impact, economic recession, global economic downturn, unemployment spikes, stimulus packages, and government interventions, social changes, work-from-home trends, impact on education, shift to online learning, mental health challenges. Disparities exposed, inequalities in healthcare, economic impact on marginalized communities, access to vaccines. 6. Global response and policy, government responses, different strategies adopted by countries, e.g., New Zealand's elimination strategy, Sweden's herd immunity approach. International cooperation and conflict, role of international organizations, vaccine diplomacy, geopolitical tensions, misinformation and politics, spread of misinformation. Politicization of the virus and vaccines, impact on public trust. 7. Vaccination campaigns and variants, rollout of vaccines, global vaccination efforts, challenges in distribution. Vaccine hesitancy, emergence of variants, Delta, Omicron, and other variants, their impact on the spread and severity of the virus, booster shots and adaptation, introduction of booster shots, updated vaccines to address variants. 8. Continued challenges and lessons learned, long COVID, understanding long-term effects of COVID-19, ongoing research, pandemic preparedness, lessons learned in public health, vaccine development, international cooperation, ongoing global health measures, continued monitoring of COVID-19 and potential future pandemics. 9. Impact on global culture and future outlook, cultural shifts, changes in social behavior. The rise of telehealth, changes in the workplace, future of vaccines and health security, innovation in vaccine technology, discussions on global health security, reflection on the pandemic, how the pandemic will be remembered, its place in history. 10. Conclusion, summary of key points, recap the major events and lessons from the pandemic, looking ahead, what the future holds in terms of public health, global cooperation, and resilience.